Welcome back to Bahamas at Sunrise. This morning, we have the pleasure of having with us Dr. Sheena Antonio-Collie, Chief Medical Officer and Medical Director at Doctors Hospital West, and Dr. Frederick Smith, Internal Medicine Specialist and Nephrologist with the Doctors Hospital Health System, joining us as a part of the series called Surviving COVID, Controlling Your Risk Factors. They'll be discussing with us this morning renal disease and its current COVID stats and risks. Good morning and welcome back to Bahamas at Sunrise.
Good morning.
Thank you much.
Thanks for being with us. So tell us, what is chronic kidney disease?
Well, I'm going to let Dr. Frederick Smith answer that. He is our Director of Renal Replacement Therapy at Doctors Hospital. And I just wanted to say that we have a Doctors Hospital Health System in this response to COVID. We are the center that will be set aside for the dialysis of patients who have chronic kidney disease that require renal replacement and who are COVID positive as well too. And that's going to be facilitated at our West facility on Blake Road. So Dr. Smith is quite an expert in this field, so he could go ahead and answer about chronic kidney disease.
Awesome.
Thanks a lot, boss lady. Could I start by doing what I normally do, cause a little bit of trouble?
Okay.
Can I switch the question a little bit and answer something else?
Go ahead.
I'll come back to your question, I promise,
Yes.
Mark.
Yep.
So, as Dr. Antonio rightly said, we are the center that are offering dialysis or renal replacement therapy for people that are COVID positive or patients that are COVID positive. And before I even say what chronic kidney disease is, I think it's important for us to let the nation know what sorts of statistics that we may have had so that they could realize how much they need to stay at home and wear masks and care for themselves and care for others.
Mm-hmm.
Hopefully, we've dialyzed between 30 to 40 people, and dialysis being when your kidneys aren't working properly, then what we have to do is put you on a machine. And the machine does the cleaning of your blood for you. Basically, we put two things in your arms or two needles in the arms or connect you via a catheter tube coming out of the neck or somewhere else. And your blood goes through the machine for about the 4 hours that you're going to be there. So by an average, we've dialyzed about 30 to 40 people that have kidney disease that have ended up with COVID.
Wow.
So out of a population, I guess, at PMH, we may have about 160 on the outside. We may have up to 300-400 people out of a population of about 500 people in the archipelago of the Bahamas. We've ended up having to dialyze about 40 of them because of COVID. So although we know that the numbers are high, statistically, that's not as bad as we think that it should be or it could be. In regard to that, we also talk about this thing where people recover from COVID or they don't recover from COVID. And we used multiple things to say whether they recovered or not. Typically, what we have used in our system, and Dr. Antonio could always correct me, is that we have waited until they've had 2 negative COVID tests that are at least 48 hours apart. So that's one way of looking at it.
Right.
And the thing with that is then they say that after 2 negative tests, then you shouldn't be able to shed the virus anymore. Because there are even some guidelines that say that a little different, that you could continue to be COVID positive but not sharing because the virus just doesn't replicate or doesn't shed as much after that. But again, out of 30 to 40 patients, out of a population of about 500, we have about 8 people or 40 people that have been COVID positive. And out of that we've had to dialyze, I should say, out of that, we've had about 8 people that have gotten better, i.e. the 2 COVID tests that are negative within that time period, within 24 to 48 hours. Unfortunately, we've had about 5 deaths. But again, I think it speaks to the volumes of how careful we need to be. And you drive around the island and you see people still bungle up on the porch and they live together, whatever, but nobody has on a mask. Man, we have to do something with that, eh? And of course, we're doing the typical Bahamian thing with the mask below the nose. The mask is below the nose hole. It's below the ears. It means that we're not protecting anybody, ourselves or anyone else.
Right. And
we've had about 4 people that we've diagnosed that have had no symptoms.
Mhm.
We've just done it because they were going into hospital to do a test or get a procedure done, and they've had no symptoms. So again, the person that's sitting next to you, man, don't sit next to them if they don't want a mask, because you just don't know.
Great advice.
Free
So,
advice.
so for persons on dialysis, does dialysis impact your immune system? And how can somebody who's undergoing dialysis stay healthy?
So dialysis definitely affects your immune system because it's one of those things that we call that cause a decrease in the immune system, like diabetes, one of those chronic kidney disease that does it. So it does. So if you're going to protect yourself as a dialysis patient, I think that all it is following the guidelines. Wear your mask. Stay 3 feet away from somebody, 3 to 6 feet away from somebody. Minimize your outgoing into public spaces. I mean, think about it. Once you're in dialysis, you're coming back to an environment in a hospital or in an outpatient center at least 3 times a week.
Yeah.
You're sitting there for 4 hours, most times in an air-conditioned, closed environment without the magic term negative pressure environment. It means that the same air that everybody is breathing in and out, you're breathing in and out for about 3 to 4 hours. Come on, man, wear your mask. Don't take off your mask to eat whilst you're on the machine. Don't try to drink anything whilst you're on the machine. You have to do what it is to protect you. Even if you're not caring about the person next to you, you got to care about yourself to protect yourself from everybody else.
And that's great advice. And that's getting into preventative action. And Dr. Collie, I don't know if you want to comment on, just from your perspective with Doctors Hospital West, how have Bahamians been adapting to the suggestions that have been putting out there, and how have you seen, I guess, an impact in terms of people coming into the hospital care system and how quickly they recover?
So, Mark, good question in terms of Doctors Hospital West and what we've been seeing. Unfortunately, we've been seeing very, very sick patients. We've been seeing patients who require what we call high flow oxygen and who require intubation, in other words, to be put on a machine that will help them to breathe. And I think that what we hope to see is that we would start to see less of these very, very sick patients. Most of them would have comorbidities. In other words, they would have some other underlying chronic illness like renal disease that would predispose them to being even more sick. And so what we've been seeing is that these patients are very ill, and hence us trying to do something with this series to help to bring light to some of the things that they could mitigate to help themselves as well too, and as well as for some information. So yeah, definitely what we've been seeing is a lot of very, very sick patients. Some of them take quite a while to recover. Thankfully, as Dr. Smith said, we've had a number of recoveries, which is always very thankful. But many of the very, very ill patients that require this high level of oxygen in order to breathe, a lot of them will take longer to what we call recover. And like we said, recovery usually requires that you have at least 2 of these negative COVID tests over 24 greater than 24 hours apart. And sometimes it takes quite a while. We've had a patient who was actually a dialysis patient that took about 2.5 months to actually be recovered.
Yes, that would have been my next question. What's the typical recovery time for a person without renal disease, and what have you been seeing based on your experience with patients?
Well, the typical recovery time really is about 2 weeks, 14 to 21 days. Typically, for patients who are not very ill, you will see recovery. A lot of patients will come back after their quarantine, their isolation time, and on retesting, they would be negative. So that's always a celebration.
Yeah.
And as you can see from the national dashboards, the numbers of recovered patients it's really exponentially growing. So we're very thankful for that.
Yes. Well, that's always great news. You know, this has felt like a roller coaster ride since the beginning, and I can only imagine how it's been for the frontline workers and for professionals such as yourselves who are helping to keep us informed, helping to heal our fellow Bahamians. And so we encourage you too to stay safe, because we need y'all to stay in this fight.
Thank you, Mark.
Thanks.
So thank you, Dr. Collie and Dr. Smith, for joining us on Bahamas at Sunrise again. We'll have you back soon enough, I'm sure, to give us another update.
You mean Dr. Collie?
Thank you.
Both of you, thank you very much. You guys have a good day. You're watching Bahamas at Sunrise. We'll be right back.